forgot to do that too. Shoot. Great. Two main people that we're working with, the Public Health District and then also the State Board of Education. So the State Board of Education has 3 categories, kind of a category 1, which is a green, a category 2, which is a yellow, and then a category 3, which is a red, kind of a fully online school, to category 1 being a much more normal school experience, and category 2 being some kind of hybrid experience. The Public Health District document that's linked in here has, which is a draft form still, right, Carol? Carol, did you? No, it's
sorry.
A draft.
Until the 6th of August.
Yes. Okay. So that document has 4 levels, which is, minimal spread, moderate.
Was that a date Carol just gave?
Yeah, August 12th.
12th. Okay.
So minimal, moderate, substantial, and then what they call kind of a critical level of spread. Really, kind of that document is the 3 and 4, substantial and critical. The critical piece is more, kind of, although it certainly focuses on what would be happening at schools, is more focused on what is going to be happening in the community. That's a situation where, you have a significant level. Hospitals are above capacity at a local level. And then, and it's just time to really, really tighten things down. So from those 2 documents, we also have basically 4 categories. So there is a category 1, which is no local community transmission, which is where we're at right now. Although I do want to caution, because it's something that I hear quite often is, look, we don't have any cases in Lewis County. Carol, do you want to speak to that? I know you've talked about it before with the no cases in Lewis County, and just kind of talk about the overall spread in our region.
Sure. So even though we haven't had a person in Lewis County who has their zip code there that has had a positive case, we've had positive cases connected to work sites in Lewis County, people that come and go through your county, but maybe don't sleep there. Maybe sleep in Idaho County, for instance, is the most connection. But that doesn't mean that we can't tie them back to being in your county. That's why we have said there's community spread in each of our counties. It's not high level spread, but there has been transmission in every one of our counties. When we're looking at our data, we are looking at it by county by county, but I've been working with the superintendents to make sure that we can drill down into that at a lower level to make it more appropriate for schools and school boards to make decisions based upon actual cases in your communities. So we're still working on that to get that drilled down to a finer level so you all can make better decisions.
And so we do. Carol and her group have done a great job. It's idahopublichealth.com, and it's this region's kind of dashboard of cases, and it is very accessible and can, you can click and drill down to some really good data about, what the spread is, what the age of people who are testing positive is, outcomes, lots, and they're trying to balance, overall public health with personal privacy as well. And I think they've done a very nice job of kind of providing us with information. I check that. I probably think about this too much, but I've got this habit now, Carol, of checking your site at 3 o'clock, and then it gives me time to do a little reading and be ready for the state information as well.
There you
go. So those are the main categories, is category 1, 2, and 3. 3 is categorized primarily by, not only do we have moderate community spread, but at this point we have a school transmission. So that's where that separation between 2, which is moderate local community spread, and then this category 3, also with moderate community, but when it's kind of coming to our school.
So right now you would call us in a category 2.
I personally, and Carol, I assume you agree with me, but certainly if you disagree, I think at Lewis County right now, and the fact that we continue to have no cases, despite the fact that there have been people in this county with COVID, I place us at a category 1. Now, I think that could change tomorrow with the report that comes out with the public health district. Carol, do you feel differently about that now?
Absolutely, I would place you at a category 1 in the green, with really no major concern at this point. And again, it can change at any time, but I would definitely think you would open in a green category.
Thanks, Carol. Okay, and then the last category, I didn't call category 4, I just listed that as soft closure. So that is what happens when, you know, we kind of deem it as not safe for the community or for kids or families for them to really be here in the school and have kind of everybody still coming to school. We are incredibly lucky with our student numbers. There are so many large districts that are trying to go A/B days and all sorts of different plans. And I hear all that thinking, and really all that splitting is doing is kind of getting down to maybe still more than what we have in an average class. And so I think, you know, basically as we progress through these, we maintain kids in the classroom until we get to that point of soft closure. So kind of tried to break down in the plan. There's several kind of main categories as we go through, but break down between what are district responsibilities, staff, and then parent and potentially student responsibilities. And I broke those down kind of building off of each category, saying that when we're in this category, we will do these things. And then as we move to other categories, we will just add on to the efforts that we're making. So some simple things, some easy things, low-hanging fruit, if you will. We plan to post lots of signs about best hygiene practices throughout the building, reminders for students and staff about, you know, protecting your space and cleaning your space and washing your hands regularly, you know, sneezing, even potentially wearing a mask or other things, but just having those things kind of set up. We have a program called Safe Schools that we pay for a subscription through our insurance provider, Morton. And so they have lots of good videos on training staff regarding hand washing, hygiene, mask handling, wearing, physical distancing, viral spread, surface infection, etc. So we would focus on the staff, you know, completing those modules. And then there's also been discussion from even within the parent group, as we talked, from staff members who are, you know, medical providers, and helping them walk staff through kind of those best practices in the medical field that can be extended to our school. So in addition to that, then those staff members can then pass that information. And our staff is very effective at this, but those practices can be passed down to kids and can become habits. That's amazing what good, you know, especially in the elementary, as those teachers work with those kids and help to develop habits, they really can, the kids can really step up to the plate and learn those things. Our kids going to make mistakes, certainly, and probably staff members are too, but that training helps. So the next one, which, you know, gets into nobody, I have not received any emails from anybody that's opposed to, I haven't received any emails from anyone that's opposed to hand washing or hand sanitizing. Of course, the next one starts to get a little more controversial. I have more conversations about this one. But that is, even at this green level, allow and support wearing of face masks and face shields by staff and students, obviously, if proper mask handling protocols are followed. I guess we'll be talking about masks as we go through this. But masks are tough because early on in this pandemic, there was a lot of information put out there by even the Surgeon General on national TV said, you know, it doesn't do any good to wear a mask. And there was a limited set of data about mask wearing. Obviously, none of it was focused around the coronavirus or COVID-19. And there was also a mask shortage. Now, it might have been nicer if the message was, we have a mask shortage, so we're not recommending masks at this point. That wasn't what people heard. It wasn't what I heard. It was a mistake. As research kind of has continued on the wearing of face masks and face shields, there continues evidence continues to develop that says that it can have a difference in impacting spread. that evidence does not say, I've never once read, that a mask can prevent the spread of a virus. It can't. There are virus particles that are smaller than a mask, but what it can do is stop larger sized water droplets that we all spit out when we're talking, some of us more than others, and we spit out when we sneeze or cough or sing or anything else like that. And a mask can catch those, which can be loaded with virus if a person is infected. And so, we've all read about it in the news that a mask is not so much about protecting yourself, especially a cloth mask is not about protecting yourself, but that it has an overall impact on the health. And I've talked to several people about it. One, I guess it's hard to think about because we all can come up with like an individual case and maybe where a mask didn't protect someone or something like that. But overall, as you're kind of studying the use of masks, what you see is a reduction in that replication rate of the virus. And so instead of a virus perhaps doubling, instead of one person giving it to one person plus maybe someone else, and then that doubles every day, you reduce it down to a level where, yes, the virus is still transmitting occasionally, but it's not transmitting at a level that allows the number of cases to grow. Well, a good example that when I was teaching math to kids is you would offer them two deals. You'd say, I could give you $1 million for the next month, every day, $1 million every day for the next month. Or I'll give you a penny today, and then I'll double it tomorrow for every day for the rest of the month. Which one would you take? Well, the kids dive right in and say, I want $1 million a day. Well, when you do the math with doubling, now coronavirus isn't spreading double every day, but when you do the math with doubling, in a month, you would make way more taking the double deal than you ever would make getting that $1 million a day. And so if we can get that rate down and slow down that doubling, and perhaps not even, the idea would be to not get to a double at all, it can have an impact, a real impact on the spread. Carol, do you want to say anything about that or mask?
You did great. They're a protection. They're not a cure. That's for sure.
Absolutely. The other thing, I had conversation with Carol. I got really lucky one day. There were several superintendents that were supposed to get on from our kind of Camas Prairie area. And I had Carol and Lenny Bonner, who's the CEO of St. Mary's Clearwater, and then also Dr. Kelly McGrath from down in Rufino. And I had them to myself, and I got to ask lots of questions. And I know, other concerns that people have about masks was, there's that idea that, look, these things are contaminated, right? So now all of a sudden, a kid's coughing and contaminating his mask. Dr. McGrath answered that fairly quickly and just talking about, imagine say it is contaminated. Say that kid has COVID and he's coughing it into his mask. Every little bit that's quote unquote contaminating that mask is less virus that's traveling out to other people. And there's also some of the newer developing evidence, which I still would like to see more on, is that that viral load, by reducing a viral load with masks, you might still get the disease, but you might not have the same course of the disease. So by kind of, I guess in theory, starting with less virus to begin in your body, that your body has more of a chance to kind of get going with its response. So if you maybe start with 10 viruses that start to replicate and duplicate, your body has time before it gets big. Whereas if you're starting with a dose of 1 million virus or 1 billion viruses that come into your body, all of a sudden that thing's got a heck of a head start on your body and what happens with the response. And so that potential health outcomes are also improved by wearing a mask as well, by reducing that.
Comment
yep.
about masks. So, we're only a month out, right?
Yep.
And we're green right now, like Carol said.
Yeah.
And things can change, but I imagine we're going to start school without a mask requirement. I'm just saying, I'm guessing.
I think, yes.
But we will have students in the school, likely, whose parents insist on them wearing a mask. That's a perfect, you know, that's a real thing. We got to be careful that those kids aren't like bullied, you know?
Yep.
Because, I mean, kids pick on each other, and something like a mask is a big deal. So.
Yep. And masks, really, to be totally fair, I mean, I think masks, especially if you're starting without a requirement, you know, bullying happens really quick anytime you've got kind of two different, and it could happen the other way too. And I think as a school, we have to be conscious of that. And we don't need to be, you know, depending on the requirements, obviously, and that wouldn't be bullying. That would be, here are the rules to be safe in our school. But if it is still allowed, I think we have to be careful not to like be taking sides or anything like that. The other thing though, I think, in just kind of planning for the future and knowing that there is that possibility of having to wear a mask, depending on our situation, is that we want to think about, you know, now is the time, and I think Carol said this to me, now is such a great time to kind of practice those things. So whether it's that a mask could become contaminated, or whether it's that kids are going to fidget with them and play with them and they're not going to handle them right. Well, there's no better time than right now to kind of work out some of those kinks. Have kids, you know, try to get used to them. See how it feels. I can't stand them. I tried to wear it for a long time today, and I mean, it's not comfortable to me. You know, I talked to other people. My sister-in-law works, manages a Subway, and, you know, she said it was like that, and they wear it all the time, 100% of the time. She said it was like that for me for 2 weeks, and then I started catching myself like I was that person that was driving alone in the car wearing my mask, and it wasn't because I was afraid of something in my car. It was because I just wore my mask all the time. I got used to it. So definitely. One thing that this does though, and where it allows for, and I know I visited a little bit with Quinn about this, is that that a student or staff member could potentially, so the next one down, I guess, a staff member could require that mask in their classroom. And there's a couple of reasons why, even at this level green, that I think that's appropriate. I should say they can require a mask in their classroom under this current draft plan with superintendent approval of a plan for that class. So that would be on an individual basis. I say it for, this is there for a couple of reasons. One, our staff are very, very valuable to us. And we have staff that are legitimately concerned that even if we're in green, we could go somewhere else really, really quick. And it might happen fairly rapidly. And that potential exposure, and there's no doubt in Idaho, again, more than 500 cases, we seem to have hit this kind of untenable plateau where we're running about 500 cases a day. And our testing percentage in Idaho remains, the positive rate remains very, very high. But I do have staff members that are legitimately concerned, and that without that, very well may consider just not, you know, taking a year's leave of absence or something else for health purposes. We have a hard time finding teachers, period. And I can't imagine in this circumstance it's gotten a whole lot easier to find staff. I'm also concerned specifically when it comes to this about substitute teachers as well, because for the rate of pay of a substitute teacher, and I imagine, I'm still playing this out in my mind, say a teacher has a potential positive to COVID and they're required to, you know, quarantine or isolate at home for 14 days. What substitute teacher in their right mind would say, like, sign me up for that class, put me right in there. And we have substitute teachers who are at risk as well, whether it be age or other health conditions. We have bus drivers. We have, I mean, that list goes on and on. And while the science still says that these kids 0 to 19 are very, very safe with this virus, I think it's important for parents to tell their kids that as much as us parents fret about it, these kids are at extremely low risk of complications. But our staff is, and it worries me, and I want to support that and make our staff feel like that it is a supportive environment.
Hey, Sean.
Yep. Yeah, Jackie.
Hey, I had, in response to Ken's comment about the bullying issue, I had a meeting with our ASB officers yesterday, and one of the big concerns they had was, what about the staff that needs to be protected? I was pretty impressed, for sure, but I think they are thinking about they're smart kids. I have to brag a little, but they know that it's not about them. They know that it's about everybody. And so I think the mask thing and the bullying thing is really, it's something that I told them, you need to let us know. Let Mr. Tiggs and I know if there's something that comes up that we can help with. But I do think that the leaders in the school are going to say, knock it off. We need to protect this lady or this man. And so I really think that's not going to be such an issue, but we will keep an eye on it for sure.
Thanks, Jackie. One of the key things I think as we talk about masks is that really the idea of masks is two-pronged. To me, one of the equally as important is that idea of physical distance. The research bears that out too. And so, as you'll notice in that part of the plan, it allows for it when in those situations. At this point, we don't have a plan to have kids wear a mask, the whole 8 hours they're here nonstop. But thinking about situations where they might have to sit right next to each other, or they might be interacting in the hallway or in some other group setting like that where social physical distancing cannot be maintained. And that's when, a mask could be required. In this case in green, masks are not required other than in a situation where an individual teacher requests through the superintendent to have that, and a plan is developed. Not going to put all of the onus on the teacher to develop the plan, but that there has to be an approved plan in order to do that. It also stops from, just everybody saying, well, we'll require masks. And Quinn and I had a little bit of a conversation well, then the teachers kind of take on as the policymakers, right? Like this becomes the policy. So continued education of staff and students and parents. This is also probably prep work about common symptoms of COVID-19. So as this, as it spreads, so that we're constantly reminded about what those symptoms are. Work with local medical providers, and I visited a little bit with Lenny about this, and they're doing some exploring to develop some remote clinics that could happen in our building, so that students or staff could check in with a nurse or a doctor or a nurse practitioner regarding COVID specifically, and having kind of a set time for that. Working through some of the legalities of that and getting it set up. Forming cohort groups, so that would start even right now in green, in that I use the word pod sometimes, most people use cohort, but trying to limit the amount of exposure. Now, the way we run our school, we run like first and second graders together for PE and music. They all go together. So what makes the most sense to me is to combine 2 or 3 classes together in a cohort group, and kind of limiting their overall exposure that way. Those would be formed even in green. We try to prevent that cross spread. And one of the things from my conversations with Carol and with Dr. McGrath as well is having that cohort in place gives, at least, it doesn't guarantee, but it gives the potential that as a school, we might say a specific set of kids are going to go online, but the other kids can keep coming. And I personally think that's an advantage, and it helps to keep kids in the school. Now, whether that occurs or not, it's hard to tell. Depends on the situation, obviously. Provide a minimum of 1 cloth mask. Our staff last year, in between teaching these online classes and making this massive shift, Chrissy and Mary, and I think Kathy Harris helped out, have already sewn a mask for every kid. And then, ones like these are less than $1 a piece, providing a mask for kids. The ISBA has, issued guidance that's very clear that school districts are not responsible for providing a mask, even if they require it. It's no different than requiring kids to wear shoes, from that opinion. And so that we don't have to buy shoes just because we require them in the building. But I think it's a good step. And kind of in my mask plan, this is getting ahead. If we were ever to kind of require masks to be on person, what I think would make sense is to have, because I know they get dirty, and you're not supposed to wear them for more than a day, but to have a mask for every kid for every day of the week that could be washed at the end of the week. So an approximate cost of about $5 a student, to have something available clean for them every week, if we get to that. And then encourage staff and students to continue to use masks and other best practices when outside of school. I've had good conversations about this. I mean, we can do the best things we can here in this building. And if people don't necessarily behave themselves in the same way when they head home for the weekend or the evening, then it has the potential to kind of undo some of that. With that said, it would be ridiculous to just say just because it's happening outside of the building that we shouldn't do anything to kind of prevent spread inside the building. Perhaps it's even more of an argument that to help with the spread of the community that we should do something else and continue to protect them. Air circulation is really a serious consideration. We don't have any forced air that pushes out onto kids. So there is very little movement of air in this building. Jackie and I are looking at getting fans for every classroom to pump air out. Also encouraging staff members to use outside spaces when it's both academically and weather, meteorologically possible. And so thinking about, if you're doing silent sustained reading with your class and it's a quiet time to just read, maybe that would be a good time, and it's not 2 degrees in the middle of January. That would be a good time to maybe try to be outside and increase that air movement. There's going to be times when it doesn't make sense, even when the weather's nice. Maybe the academic activity that you're doing is just not conducive to being outside. But there'll be other times when we can consider it. Training students regarding hand washing, hygiene, mask handling, physical distancing, viral spread, surface disinfection, all of those things that they can be aware. And then just a note with the parents thing that as we talk about masks, that parents could provide a mask that best fits their student. My wife is like a mask buyer. She likes to sample all the different types. There's a million different ones out there. And I know even within my family, different kids like different ones or prefer them. So just that even if the school district were to provide a mask, that they would have that flexibility to find something that works for them. And I think in some ways we would want to encourage some freedom. I don't want a kid walking down the hallway with a Keystone Light can on his mask or vulgar language or something like that. But hey, this might be, kids like to express themselves. They like to be individuals. And this might be an opportunity to kind of encourage that for a year.
So a lot of people are still wearing just like face coverings and things.
Yeah.
Is that going to be admissible too, or just regular masks?
Yes. Face coverings are okay. Right? And it's still anything to kind of stop those water droplets is the idea. So a lot of people, I see a lot of farmers wear like that gaiter, to maybe even cool them off, but also just, I prefer that. When we went camping, I wore one, and I might be nice in the winter as a little bit of a turtleneck, cover your face when it's cold outside. But also it's very, it's quick. Yeah. And relatively easy to use as well. And so I know people do that. But yeah, anything that's covering your mouth and nose with cloth, not interested in really getting into the mask police about how many layers and et cetera, et cetera. Okay, so then in this PPE section, in category 2 then, so this would be with minimal, moderate spread. So when we're starting to see it in our community.
Sean?
Go ahead, Jackie.
Yeah, I just want to ask Carol a question about those layers you mentioned, because I was watching on the school safety thing about the layers. Does that matter? Does it have to be a minimum number of layers? You got your mute on, Carol.
Oh, so sorry.
That's okay.
Is that better?
Yes.
Okay. Initially, they were, tried to do a whole lot of comparison between the N95 surgical, hospital mask and the cloth face covering, and thinking that several layers of the cloth covering could almost get to the point where it was as good as a surgical mask that they were in hospital pre-op and things. I don't think that's as important as just, like Sean said, a barrier that catches those large droplets. So
Okay.
I wouldn't be concerned if it's 1 or 2 layers. If we've got a layer at all, I think we're going to be really good.
Okay, I appreciate that, because it was just something that came up, and I just want to make sure I understood that from your
But for the rest of
perspective.
us that are really anal about this, you put a coffee filter inside of the layers and then you're really golden.
Oh, okay. Those are cheap. Thank you.
Yes, yes.
And many of our girls have one for different colors to coordinate their outfits. So I think they're set. They're really excited about that.
That's awesome.
For what that.
So in category 2 is when we actually know we have cases around. This maybe not a case in the school, but we have cases around or nearby. This is when we would require masks for students who exhibit symptoms, as defined above with COVID symptoms, and then meet the criteria to send home. So that would be where, you know, a mask would immediately come on. Limit visitors for staff and students and volunteers who come into the school. Again, this is just kind of protecting. You would need administrative approval, and that would include even staff family members. Require masks for visitors. Parents could still come to the school without administrative permission, obviously, but as they would be required to wear masks when they're inside the building. Require use of masks and face shields when physical distancing is not possible. Now, this I changed again last night. It just a continued discussion. At what level the board kind of feels comfortable. Because like I said, I know there's the potential for pushback with this. And so it's changed back and forth a couple of times. And this was late night me, and I changed back and forth sometimes. But, you know, whether that at that point in the yellow category, when we do have some community transmission here in this town, if we do have, whether it would be required or still suggested. Again, this is just a draft and can certainly be edited by the board. This would be kind of specific to these kind of tight times when physical distancing cannot be maintained. One of the biggest, I guess, potential pinch points for me as I'm thinking about this is the moving of students in the secondary building during a common time. I've played around with a lot of ideas, and there's still some more that I just have come up with and I'm still teasing out, but it's really difficult, you know, when you have the limited number of teachers that we have. We've talked about shifting actual transition times, but all of the teachers are busy, and even shifting times, all of a sudden you get this stack up of kids waiting to go into another classroom because, at this point, I think we would still plan to have passing times and movement of students. Some talk about reducing the number of times that occurs through scheduling, but the idea would be in this yellow because we're getting some community spread. When we just know that there's a very clean situation where 6 feet of distance can't be maintained, so like moving between classes, we would require masks.
So in that kind of situation, I mean, are students just going to be required to have their masks?
They
somewhere on
would,
them? I mean,
then.
if they don't.
If it was required to happen in these regular situations that we know of, then they would be required to have a mask on their person. Yeah.
So it's going to be a challenge too.
Mhm.
That's happening.
No doubt, no doubt. District will provide a limited supply of reusable and disposable masks for those that forget. That will happen. District issued a mask is not comfortable, then they can provide their own. If the district mask is also for students, they can provide their own. And then 3, when we get to kind of a moderate to almost heading to substantial spread, but still what is classified, at least in the public health district, as moderate. This would be when just full requirement of the use of face shields and masks when physical distancing is not possible. Like I said last night, I in my thinking bumped this down, and before I hear it, it was recommended for those situations. But one thing I think we need to think about is those situations like in the hallway when it can't be avoided at all. Again, students would be required to have a mask on them at all times. If group work without physical distance is required, they'll be required to wear masks in those situations. And then at this point is when you really would want to keep students in small groups, consistent groups for 3 weeks. What that helps with, as we start talking about this potting and cohorting, is that if there is a case, the more that I think, and Carol, you can speak to this too, but one of the first questions is what students was the infected student or staff member in close physical contact with for 15 minutes or more. And so by kind of keeping any grouping consistent and by requiring mask wearing, the hope is that that would reduce the overall number of people impacted by it. Carol, do you want to add anything there? Oh, you're muted again.
Oh, sorry, my fault. That's part of public health's job when a positive case is diagnosed, that we would go in, help the family and the school identify the close contacts. Like Sean said, more than 15 minutes, less than 6 feet apart, and no face mask or face mask. If we have these little cohorts or little pods that we know are their close contacts, you could actually just take one little pod and say, okay, we're going to first of all send you home for the 2 days. We're going to rest the room, clean the room, and then by that time, public health in the school will determine who the true contacts are. It could be that that whole pod has to stay home 14 days and watch for signs and symptoms. Could be part of them, if they were wearing face coverings, get to even come back to that classroom. But the rest of the school, other than siblings in other classes, they would also need to go home. But the rest of the school could operate, even if there had been a case in one classroom. So the significance of those little cohort groups or those little pods becomes a real good mechanism for helping decrease the spread throughout the whole school, and then allows you to stay open as well. And that's our whole goal: open and keep you open throughout the year.
Yeah, and Ken has a question, Carol.
So Carol, in the case where we had an identified student with COVID and the health district is working with that family, do you also work on, like, because I see kids, walking around town after school, do you work on those contacts to see which kids might have had contact outside of school then too?
We certainly do. And then part of that's what we call contact tracing. Somebody has to give us those names and those contacts, and so we can follow up with them. But we call those people the close contacts. So this case would be the parents, if they're, have younger children, every day for 14 days to make sure, first of all, that they're well, or that the contact has or has not developed signs and symptoms. And then again, to also make sure we ask the questions, are you staying home? Because part of the decrease in the spread is that they need to stay home. Not be out in the community, not be at the youth center in, after school or nights or weekends. So that is part of public health's job. Now, it goes as well as the cooperation we have with those families. But so far, we're doing pretty good.
Thank you.
Carol, I have a question really quick. So as fall comes along and we have all these other viruses that come around, what are you expecting the turnaround time to be for a test, COVID test?
That's a really good question. Even right now in our district, we're testing, and because of the increased testing in Coeur d'Alene and in Boise, they kind of have plugged up some of our labs that are being used for testing samples, which are primarily the labs in the state of Washington. Right now, we had been at about a 3-day turnaround. We had some today that the sample was taken on the 24th, which was last Friday. So we're looking at, almost a 6-day turnaround. That's a long, long time. The state of Idaho is looking at increased lab capacity in every area. So they're trying to build out testing capacity in every area. So we shouldn't have to wait for more than 24 to 48 hours for a test. That's part of the goal coming up for the fall. We're hoping that will happen, but that's again why the relationship we have with the schools is to get this done as fast as possible if we would need to do testing in the schools as well.
Testing really becomes, it's huge, and I have it in here just as far as being advocates of testing. It makes it really hard. You're driving through a fog when we don't have kind of accurate and fast, relatively rapid testing, because you're trying to make decisions. 6 or 7 days, really, it scares me, because in 6 or 7 days, there can be an awful lot of spread in a community that is going kind of undetected, and then all of a sudden you're already, just a raging wildfire at that point. So something to continue to advocate for, I think, and work just between schools and the public health district and the medical providers to increase.
So let's say in one of those pods,
Yeah.
someone is suspected of having COVID, so they get tested.
Yeah.
Like, wait for the test results. Is that whole class getting sent home until we get the test results?
I think a student with, and that would be a conversation with the public health district, a conversation with the medical providers. But that is definitely a possibility that they have to go home for that period of time until that, especially if testing is delayed. Now, my whole, and it's another argument for just how we all impact each other. Like, yes, Boise is very serious right now with the rate of growth, and same with, Kootenai County as well. And what that is doing is having a really negative impact on like this, the North Central District, trying to kind of track and prevent any of those kind of future. So it is an argument just, statewide, if we can behave ourselves and get this thing under control, then, and we can get it to a point where the testing capacity is sufficient, it will be to everybody's benefit. Carol, did you want to say something?
Well, there is a new recommendation through the governor's testing work group that there is capacity for testing at schools if we need to in the fall, throughout the winter. We had a call about that today. There's extra money that they've set aside for the Department of Education for this to help pay for testing so that families wouldn't have that burden as well. And then again, the discussion on the capacity, we can swab all we want. It's just where do we send the tests, in which lab, to get a quick enough turnaround that it's actually helpful in making sure the school continues to open. So there, like Sean said, this is a rapidly moving, high priority issue, and we're all lobbying for it greatly. We have very few weeks before school opens, so the state needs to get something going.
Thanks. So then students would be required at this level required to carry a mask. Group work without physical distancing, masks are required. Keep students in small groups, I covered that. And then 3.1 and 3.2 are kind of specific things like you talked about, Carrie, with if there is a case in the school at this point. And so that's where, the other piece, I think there is a group of people, which is perfectly fine. I'm not necessarily making any judgment that, when it comes down to it, if masks are required, that would prefer, and they are free to do so, that their child not be in that situation. So I think it's important, if that was the choice, that we do, while maybe we're making a decision in the best interest of the district, that those families would still be supported. Basically, at that point, it would be prior to switching to something online. But my proposal is to have it be just a live stream of the class. So if they are adamant that they do not want their child wearing masks, and they have their reasons for really ultimately whatever reason, then they could certainly pull their child out of the classroom, and we would continue to educate them. In order to, that gets really difficult for a teacher. Again, going back to the teacher, now you're trying to manage an online class, in-person class, and all of that. So the quick shift would potentially be just what I'm calling a live stream of the classroom. And so they would be sitting at home on a Chromebook and beaming into the classroom. The teacher might have them up on the Promethean board or on their own computer, and they would be sitting there participating. That doesn't mean that necessarily the whole day they would do that. The teacher might say, hey, look, it's recess time or it's lunchtime. Go ahead and hop off and I'll see you in a little bit. Or maybe during some independent work, it would be, go ahead and hop off and we'll see you in a half an hour or something like that. But that those kind of things could happen. Now that gets a lot more difficult the younger and younger you go. So that's part of this continued work with the committee that's looking at kind of what does it look like if we go online like that.
Curious, quick for you, Sean. You bring this up, here in stage 3 or category 3 about the live streaming. Have any parents discussed? I mean, is that not probably? I could see it happening already right off the bat.
Yeah, I think.
Don't want their kids at school.
Nobody has come out in the surveys and 100% said that their child is going to go online. It's a good point. It is definitely a possibility, and I think people will I mean, you'll see a shift if there are one or more positive cases in the community. People that are kind of like, well, I'm on the fence, because there was some of that in the surveys, could pretty rapidly shift to, maybe their child's at risk and they say, well, it's just not worth it now.
So we are preparing for, in essence, day one. Some kids could be live
I
streaming.
think we have to be ready day one. Yes, that's right. And we have to do a little more thinking still and planning about what that looks like especially the lower grades. Attendance wise, I think from last year and the way that the state rules were read is that as long as we're providing that educational service, and if they're attending something like that, that we would still count those kids in attendance. And the other place that this falls in is if you do have a case in school where, or maybe it's not even a case, but the health department says that kid needs to isolate, that we would do that live stream, that we would, provide it for him. So, yeah. And then the last one is the soft closure. And this is where priority students, those priority students we talked about, would still be allowed to attend. In my mind, we would still run the bus routes. Might not mean all the bus drivers are driving them, depending on the number of students and where they're at on the routes. The school would effectively be closed, but we would find those kids who are, in the highest needs. And then also, we would think about staff members who are maybe at a lower risk or who are still comfortable being here in the building to kind of support that as well. This would be when staff and priority students are required to wear masks at all times. So this is when you're getting into a significant amount of community spread going. Now, there's also the possibility that with all this stuff, that, if it's a massive enough spread, that my conversations with Carol might be like, you just need to shut it down. So that's always still on the table, like completely in a short term. I think that was one section. So screening is the next one. So screening primarily is focused on, what do we do to make sure that it's not coming into the school as best as possible. Again, none of this is perfect. And the fact that children are seemingly more or less likely to be symptomatic makes it even more difficult, because, you can screen, and if you have kids that are symptomatic, then you're going to miss them, even with a good screening. So this is screening visitors and volunteers who come into the school. Carol's provided us already with a screening tool to kind of go through some symptoms, some temperature check stuff. Continuous monitoring of absenteeism. So this would be where Mary in the office, when they call and say, my kid's sick today, instead of just saying, okay, thanks, bye. This might be a question about, are they experiencing these symptoms if they're sick today, so that we can at least be aware and ahead of potential cases. Staff and students who suddenly exhibit symptoms as a part of this screening should be immediately isolated, should be required to wear a mask at that point and go home. We would require any student or staff who's tested positive, and this has changed recently. The CDC has issued new guidance, so it actually needs to be updated. But the CDC has said if you test positive for COVID-19, and you have to wait 10 days from the beginning of your symptoms, and your fever has to be gone for 24 hours. And because of some kind of, you can still test positive even though you're not infectious. They say at 10 days, you're not required to have another test, a second test to come in. And then
this is where I see that live streaming class. I mean, a kid
Yeah.
has a fever, well, you're out for another day.
Yeah.
They're going to need their schoolwork.
Right. It is interesting, Carol, to me, and you might want to talk about it. If a kid doesn't have a test and it isn't confirmed COVID-19, is it 14 days as long as they have those symptoms? But if they have had a test, it's only 10 days. Is that correct?
So if they're just exposed, they need to be home for 14 days, even if they don't have symptoms, if they have a direct exposure. But if you're yeah, it's the 10-day thing for people that have symptoms. We start with 24 hours before their symptoms started. They have to wait 10 days. They have to be fever-free for 24 hours. And their other symptoms have to be improving. So if they have a cough, it has to be getting better, not worse. By the time you put all of those things together, it's really about 14 days. So I don't know why CDC decided to give us all these extra numbers. It would be simpler if we just had one set to go by. But in general, it is about 14 days. It's 14 days for almost everybody.
No, that's 14 days after exposure.
14 days after a potential exposure. And some of that,
So if a kid just has a fever, it's 24 hours.
yeah.
Right. Right. If they're just going home with a fever or a stomach ache or whatever, they have to just be fever-free, symptom-free for 24 hours, then they can come back if they haven't been tested and they haven't been a direct exposure that we know of to someone else. So, because we're still going to have all the stomach flu bugs and the regular influenza bug and all of those things going around. So again, it's that 24-hour time frame unless we know that they've been exposed, or have someone in the home or something else that's going to have those symptoms. So your idea of having your person who does the checks on the kids every day that says, okay, what are you homesick for? Having them kind of keep a running tally of what those symptoms are will definitely help public health as we're trying to figure all this out with you.
Thanks, Carol. So then as we continue to screen and we move into category 2, there would be, oh, excuse me, I didn't get down to the bottom. So at the bottom in green would be, and Carol's provided me with this list of screening, but it would be to encourage parents to conduct daily health screenings. So that a parent would get used to perhaps taking a temperature, ask, a couple of questions of their students, as far as symptoms. And that is more, again, not that it's the most important, we're in level green, but some of the things that we do in level green or in category 1 will help when we have to make a sudden shift. So if kids have a chance to practice wearing a mask and screw up a little bit while we're still fairly low risk, if parents have a chance to say, okay, what are the symptoms? Let's talk about them every day and find out if my kid is experiencing that. Those kind of things can help ease the pain as opposed to just going to a sudden, oh, we're in yellow or red and now we have to do these things. And we haven't built those habits. So we would encourage parents to do that, not require it at that point. Category 2, we would develop a screening process for staff or students who feel ill at school. Encourage and establish self-reporting of symptoms by staff and family, maintaining individual privacy so that they would feel safe telling us about symptoms, just even within their families. Require staff to conduct and document daily self-health screenings. So this is when staff would document a daily health screening. It might be on a spreadsheet, and they might just go through a little checklist every morning that they're, where they're at. That also could potentially help, public health district look back and see where some symptoms began and where the spread might have started. Require parents to conduct daily health screenings. Now, I know when I put required, this isn't about me. I'm not going to request a daily email from them about symptoms, but saying that, look, we're getting some community spread. It's required that you do this. We're not, again, you have to balance what's enforceable. Is that really enforceable? Probably not. But I think it's still okay to use that language of require. In category 3, as the spread grows, eliminate all non-essential visitors and volunteers inside the school buildings. Remember, they'd still have to wear masks. Staff would conduct daily health screenings of students. So that's when, you require parents, not really enforceable. At this point, then staff would be doing those screenings, including temperature checks. Purchase lots of infrared thermometers. If we had every staff member doing it, we still need to purchase more. Staff and students who test positive, that's where that 10 or 14-day window is. So that's the screening. And then if we ever got to substantial spread with those at-risk students, we just continue that mandatory screening of students coming in. So sanitation, like Ken said, there's a potential cost. The state is providing funding in lots of different areas. There's a lot of money coming in. Honestly, our budget will probably end up bigger than it's ever been by far with state money that's coming in, whether it's for technology, whether it's for PPE, the potential of testing, the potential internet access for students. There's money coming into the district that we've never received, mostly kind of from federal funds. Right now, it is incredibly, it's a very difficult environment to navigate because we all know how fun federal funds are to work with. Lots of red tape, bureaucracy, and then it's funneling through the state and what they have to do with those monies, and then it's coming down to us. And a lot of there's little pots, right? Like we have $1,500 to train staff on an LMS, the learning management system. And we have another $100,000 that we found about that's to purchase technology or a few other uses like that. Those are all, it's nice to have that pot of money, but it's also, it increases the burden on Marcy and myself for sure. And I know, state departments, they're swamped too, because all of us are feeling overwhelmed about, well, how can we spend that money? When can we spend that money? Which application do we have to fill out to access that money? It's really overwhelming, but it's there. And we'll hopefully continue to access it and use what we can. Physical.
Any of that money that could help Marcy have an assistant? Too?
One of the things that's disappointing to me is that as they've managed most of this money, almost none of it is really usable for staff. A lot of it needs to be expended by the first of the year, and that it really is just stuff. I struggle a little bit to find out that I'm perfectly happy to get $100,000 for technology, but in a school where we already have a Chromebook for everybody, sure we could get a new one, I guess. We already have an iPad for every elementary student. I would like to use that $100,000. One thing I thought about right away when I heard about that money, I'm like, great, we'll hire an online education liaison. Someone who's just, their job is to communicate with parents, take it off my plate, take it off teachers' plates, and kind of just navigate that online environment. Well, you can't use it. You have to spend it before the 1st of January and can't be used on personnel. And so it really is a challenge. It'd be nice to add people and add help, because people like Marcy, people like Mary, Jackie.
So you can't pick up an extra custodian or any of that.
There is some potential still in that money, but not in that big pot.
Maybe a robot.
Yeah, you can buy a robot. Just can't buy a
This is
person.
with a gazillion people unemployed, come on, get real.
Right. Yeah.
There's lots of them are teachers that have been laid off.
That's true. So physical distancing, we would require physical distancing to be maintained at school assemblies and larger gatherings. We would limit school assemblies, but as long as we could maintain, as small as we are, as long as we can maintain 6 feet, and it fits with kind of that cohort model, there could be some assemblies still. Implement strategies that discourage gathering in areas such as bus lanes, restrooms, recess, hallways, lunch, and before and after school. That little sentence, and I've talked with Jackie about this, and as the principal, she's really going to have most of that sentence with me being her assistant principal. That is a lot right there. That one little sentence could probably be a whole nother plan, because kids are social. They love interacting with each other. It's a very human thing to do. But we have to come up with ways so that we don't, we can do the best things over here, and then we allow for these other circumstances, and all of a sudden we've kind of blown some of our effort. And so, what some of those ideas are, like elementary students coming just to their classroom door. We'll no longer have that early in the morning, everybody huddles up in one spot when it's January and freezing. You'll just go around back, or you'll go in front. High school students coming to their first hour class to start the day, as opposed to just kind of congregating in the hall. And other things, lunches, restrooms might be, limiting it so that only one student from each class could potentially go to the restroom at a time, at least at the beginning, and maybe even tightening that up. So plans for increasing physical distancing within the classrooms, that's, work of the teachers and throughout the school for us. And again, the goal is to maximize distance. I'm 100% certain that we cannot guarantee 6 feet of distance between every kid for the entire day. It is impossible, and it would be ridiculous. But what we can do is try to design our classrooms, individual teachers can, so that we maximize that distance. Is 5 feet as good as 6 feet? No. But is it better than 4 feet? Absolutely. So, just again, try and get that space. And most of this is, when you're inside and sitting in a common location for a long time, and we all start breathing the same air, that's where physical distancing can help. Limiting group work, I mentioned this, the restroom use, teachers arranging classrooms to maximize physical distance between students. And then there's those other parts that I talked about in there. As we move up, we would develop protocols to reduce student movement in the building. So as we move in, not in category 1, but in category 2, we'd have those conversations about, okay, well, maybe we should keep the 7th graders just in a single room for the day and move the teachers to them, as opposed to allowing the students to move around. That is really difficult in high school. I mean, by the time you consider athletics, by the time you consider they have electives, they're going to be mixing anyways. So ultimately, our 9-12 is going to have to be treated as a pod of 40 kids.
I was gonna say, yeah, because we're sports in this.
Yeah, there's
They're
no
commingled all.
there's no
afternoon.
protecting against that. And I know I've also had people ask me like, well, okay, great, you keep the freshmen and seniors together, but then that, your freshman goes home and they've got a junior higher at home and an elementary kid at home, and now all of that is true. I mean, you can't help it. Again, all we can do is help what happens here and try and prevent that spread here as best as possible, and hope that people, kind of being wise, continue to practice some of those practices at home. But it's really difficult. As walking through this, space students as best as possible in the classroom, eliminate group work in the secondary building, still allow it in the elementary, but under certain circumstances. We do think, Jackie and I, that some group work could be done digitally without the necessity to have kids right next to each other. Eliminate multiple grade level school assemblies, establish homerooms like I talked about. Elementary group work is still allowable even in that red stage, but again, encouraging mask use. We want kids to have as normal as experience as possible. When people talk about, well, this is the new normal, I've tried to be very strong and say, I don't really like that idea of a new normal. From my study of these things, I think a temporary normal is really the way to go. So these are small adjustments. I was talking to one of our staff members yesterday about a potential change in schedule that on any other year, I would never, ever consider to be, academically superior. I wouldn't even necessarily consider that. But on this year, given these circumstances, it might be something that warrants, trying, because it reduces the risk of students, or the risk from students moving around. Just, again, not that we're going to do that, but, you have these conversations. And so, again, it's not a new normal. I don't expect us to wear masks forever. I really don't. But it is just kind of temporary things that we can do to be safe. And then when we get into that final category with those at-risk kids that would still be coming, just depending on the number of students, we would use every square foot of space that we have in this building with a limited number of kids. So, one thing we did the last couple of weeks, or last week of school with some kids that were really struggling, we put one in a room. And, we've got lots of different rooms, and so they were by themselves in the room with someone just kind of monitoring them or moving around. So we would have lots of space. And again, I don't think it's the wisest thing to just completely shut the building down, but to be very smart at that point. Any questions about physical distancing? Okay. COVID testing, I mentioned this already, and I know Carol's mentioned it too. The best we can do is continue to advocate for that. This is really important. We're half blindfolded, flying down the track without this testing. It needs to be quick. It needs to be accurate, obviously, which I think the accuracy is there, but we need to know the results so that we can make informed decisions about what to do with our school. Some of that is out of our control. And I honestly think that this plan is probably a little more restrictive than it would be if I felt like we were in a situation where, look, we know if we're going to get a test, the kid's going to have it, and by the end of the day, I'm going to know where we're at. If that was the case, perhaps you loosen some of this. And you say, okay, all of these things don't necessarily have to happen because we can respond very rapidly. Lacking that, I guess, and it's an argument for masks for me. Lacking that, I'm going to have to call Carol when she says I have a positive. I'm going to have to say, well, they've had 7 days of exposure. in this building and try to track down what that 7 days of exposure is. It's going to be a lot easier conversation if I say, well, we were in cohort groups and we were physically distanced and the kids were wearing masks that he came into contact with. Well, now we're at least a leg up on that. I don't necessarily like how restrictive this is, but this is where we're at right now. Staffing considerations. One thing I wanted to present to the board, this again, no action tonight, but allowing for that year's leave of absence. It's going to put us in a pinch, but if a staff member ultimately really feels that they're at risk prior to the start of the school year, that we would be flexible with that and consider a year's leave of absence. There's a policy on the year's leave of absence. Generally, they would have to request it prior to now. Obviously, they've already signed contracts, but I think in this circumstance that we would, subject to board and superintendent approval, would allow that if they just.
What does that look like? I mean, is that they take a year off, no pay, or they're still paid?
No pay, no benefits. They would have the option of COBRA, still paying for their insurance if they elected. What it does is it holds their position.
They come back, don't lose no seniority.
Yeah, and the thing it does do is there's no guarantee that you'll get the exact same position back when you come from a leave of absence. So you might completely it's kind of hard because we only have one teacher at every grade level, but you might leave as the science teacher, and when you come back I say I need you to teach math now, but you have a position if it's approved by the board like that. That wouldn't be, I guess they could still lose a position if there was a reduction in force that happened, but otherwise they would have a position.
That's more like an FMLA, but just for
Yep.
a year.
For a whole year, unpaid, everything. Yeah. I think I originally, some larger districts have an advantage because some of their most at-risk staff, they have big enough numbers that they can pull those staff to do like an online class. And they have enough kids to kind of pull and put in there. Now, maybe they have too many at-risk staff, and so they're struggling with that. It is something to consider if that circumstance were to come up where we have a staff member that wanted that. Like I said from the survey, I don't feel like there's enough parents in the position we're in right now with 0 cases in Lewis County that are wanting online learning. I think they know the benefits of being here. And so, I even thought in my mind when I did the survey, if I have 10 elementary students that just want to do online, I could certainly poll a teacher and say, hey, that's what you're doing. Maybe it's like a one-room schoolhouse, right? They might have a kindergartner and a 6th grader, but they just run that one-room schoolhouse online. Well, at this point, we don't have those numbers. And so I just don't think it warrants it. Staff who request leave of absence, that's what I have there, consider moving to online. Again, just the determining of which staff consider themselves to be at risk. And as much as reasonably possible, limit close interactions with paraprofessionals and students. They're one of those that kind of, the parapros in their work kind of blow apart our cohort model. It's like the music and PE or some other things. It's where all of a sudden you're like, oh, we got them cohorted up. Well, that parapro might work with, on some speech activities or something else with lots of different kids. And we don't have enough parapros to kind of pot up the parapros. And so it's a challenge. And then I think the other thing with staff is, and this is a sacrifice for staff, I know too, because adults can transmit it better than like these 0 to 9-year-olds. I mean, we really have to consider limiting staff close interactions as well. I might be sitting at the same, table at lunch, or the copy room is probably in some ways a higher risk area given the rate that adults spread it than being in the classroom. Or those little kind of hangout times with teachers. It'll be an adjustment for them as well.
You probably don't have enough substitute teachers or are you thinking of trying to rotate them, that the sub's not one day 1st grade and then the next day 6th grade?
I would love to be able to do that, but again,
only got 4 or 5 subs
so you've hit
available.
this weak spot of like, and I know there's some subs from last year that were like our rock stars that showed up a lot, and they were the ones that always said yes, and I know there's a couple of them at least that are basically have talked to me about just that, not this year. I'm not going to do it. Subs are going to be very hard. I can imagine, I mean, just a couple of teachers that have to quarantine or self-isolate, and, we're gonna be trying to throw people around to get some double coverage and having staff in-house do some of that. It's a real challenge. Which again, is I guess my argument for if we wanna be in person and we wanna focus on this, then let's do the best things that, science is telling us to do to stay in person. Because that is what I believe is the most important thing. Without a guarantee that that's going to happen, but let's try it. Let's focus on, our goal is to stay in person. Our goal is to have kids here in this building. Based off of that goal, what do we need to do? And we have to be willing to make some sacrifices.
I think the staff compliance to social distancing, masks when they can, and those things is way more important than the students because of these restrictions on staff. You just imagine if one staff gets COVID and had contact with 4 other staff members that are isolated for 14 days, we're almost going to have to shut school down because of that.
Well, that's just saying, not just this school, all the schools, and there ain't enough subs out there.
No,
Yeah.
there's not.
So it's really going to have to be an important thing for staff to.
And we don't want, one of the things that was suggested the other day that I don't have on this that I think we need to continue to build out is the mental health piece. Because of these shifts and the natural things that we do as humans, for staff who are being asked, well, don't go enjoy a cup of coffee with your best friend in the morning before the kids show up. Or, because that's not a safe thing. Those things, we have to find other ways to support each other, not in a new normal, but in this temporary normal. So both staff and students have that support.
I think the staff wants to be here.
Yeah, I know. Yep.
Just.
They are itching. Absolutely. And this commitment, when I started meeting with, it was my commitment, I guess I would say, and I know sometimes people wouldn't like to disagree with me, but I know we've got staff that does like to disagree with me. I came with the commitment, I think we need to have kids in school. The teachers that when we met, it was unanimous. They were like, this is the most important thing. And so if there are some other sacrifices that we have to make, some uncomfortable things, the staff wants that. They want to be, and I honestly, in the 12 parents that have been a part of this team, I haven't heard anything different either as far as that. So,
Well, the staff that I talked to, they didn't say, I missed my friends at work.
right.
They say,
I missed the kids.
I missed my kids.
Yeah, that's very true.
So,
Very true.
I know I made that comment, Sean, but also I think we should look at about 30 minutes.
Okay. Okay. So just allowing for remote work for staff, I think I'm through most of the longest stuff.
Okay.
Allow remote work for staff to deem to be vulnerable when they can and allow that to occur. Support some staff members who have to work from home. Try and be quick. As much as reasonably possible, limit close interactions with parapros. I covered that. So instruction, this is a big piece, and this is why really we have a separate committee just looking at this. A lot of the early stuff is that we're planning and preparing and having something in place for us to be able to shift to potential soft closure. That some stuff from the surveys that we've sent out includes kind of standardizing our apps in the elementary. That's one thing that we heard was that it was really difficult when different grade levels had a bunch of different apps to use. It includes kind of developing the schedule for the secondary and everything else. And then ultimately, this instructional piece is setting up times that are reserved for elementary and secondary meetings. One other piece of feedback we heard is that parents kind of wanted some more regular, even if it wasn't daily, some more regular meeting time with our elementary teachers. That was feedback that we got. Our secondary, I think, did a good job at that, and the elementary did too. But just the kind of consistent, knowing when to meet, and then some principles for online. So then, lunch and food services. I guess we can continue to read through that. Like I said, this document will become public as a draft tonight. I will post it on the website so that other people can read it in more detail. Again, distancing of students, limiting, cohorting of students are the primary focuses of that. hand sanitizer availability. So all of those things that need to happen with lunch to make sure we're in cohorts, we're distanced. Kids don't have to wear masks when they're eating, obviously. Student transportation would, one of the changes in policy would be elimination of the use of any food on the bus. So on activities, because the eating, especially in kind of a dark environment during athletics, not be recommended. Require bus drivers to wear a mask. I think our bus drivers are actually very open to just wearing masks given their own situations, and I don't think that's a big deal. Regular sanitation of the buses, that would be after each route. It gets sprayed down. The bus drivers would do that. I don't know, I'm trying to move.
No, I just,
Yep.
I'm sorry.
Yep, back.
On the lunches, are you are we gonna still allow them like an open?
Yeah, I've had a couple of people ask about that. My thought is at Green that kids could still go, and then that's when we would when we start to get some community spread, we can consider you need to either bring a lunch or eat it. That's not going to be super popular with high schoolers, but I just don't think at Green that it warrants. I mean, to take that away is just one more kind of knock when we haven't had much. It is one more risk.
But yellow and orange, then you're probably looking at
That's
like last year, like how they sent it out on buses and
yeah.
they eat in the classroom or.
Well, I still think as big as we are and as much space as that cafeteria has, we got lots of plastic tables. We could have, two kids at each table and still use the lunchroom. And I talked about pods then, kind of in that last stage.
Yeah.
I don't remember actually in here, now that you said that, I have in here that we would cut off.
We put plan for possible grouping of lunch service times.
Yeah, I was looking for the, going home at,
I didn't see those.
oh, maybe I missed. No, I don't see it either. My thought would be probably when we get to the yellow level that we would say no going down for lunch for the high schoolers. We only do that for high schoolers. Junior high already has to eat here.
Oh, you just cut them off from leaving campus.
Going to the store and mixing. If we've got a lot of community spread, then we wouldn't, or some level of community spread.
Go back to a closed campus rather than open.
And technically, our policy says we are a closed campus that just happens to allow high schoolers to go home with the parents have to sign a permission form, and there's some specific rules. They can't ride in someone else's car unless it's a sibling. And I think at Green, I feel safe that they would still be able to do that as long, and then tighten it up when needed.
It's pretty fine line because some of them walk down to the store, but some of them do go home for lunch. Like your kids go home for lunch.
Some of it is balancing that, is that there's two possibilities with if a spreading event occurs. One possibility is that the community is growing and that floods into the school, the cases. And the other possibility, which is probably the bigger nightmare for me, is that it was the school that kind of was the seed or the source of the spread, and then we push it out to the rest of the community. And so I want to avoid that as much as possible. Student transportation, extracurricular and intercurricular activities. I will give you my read on this. I'm as big a sports supporter as there comes. I think whatever we do, we need to focus on letting these kids have some athletic opportunities. It is great for kids. It's great for their mental health. It's great for their physical health. It's great. You learn so many things in sports that you just can't even replicate in the classroom, I believe. I love the fact that at our school, 90+% of kids participate in at least one sport. And, 80% of them participate in every sport, every season. It's a really good thing. With that said, athletics is a pretty big risk to this whole plan. And it's a pretty big risk to our commitment to trying to keep school in person. And ultimately what we're here for is the education piece. This is definitely an important part of that, but it's the academic piece. And so I am willing to do, the IHSA has put out guidelines. They're meeting again on Monday. I don't have any guarantee of this, but my expectation from conversations that I've had is that the start of this fall sports season will be delayed in some format. I think some of that is because, we always joke there's the great state of Boise and then there's Idaho, but and where the outbreak is happening right now is in Boise. But there's other pockets, Kootenai and now, Bonneville County and Twin Falls are both seeing kind of rapid growth. And so there's no guarantee, and a lot of sports is going to be out of our control. If teams start all of a sudden dropping out of the league, or if the IHSA makes decisions that are like, well, we're going to end the sport, well, then all of a sudden things are out of control. So Jackie and I have been talking about a lot of different ideas. I mean, we'll see what the IHSA says, especially at this next board meeting, and then at future board meetings if they do indeed delay. I am in support, if it came down to it, to not allow fans at games. We've purchased now a Pixelot system to be able to live stream games through the NFHS network, so that everybody can watch those games if that was a possibility. When I say I'm a supporter of no fans, I would say if it meant the difference between kids not playing and playing, I would say, well, then we'll forego fans. I would be supportive of that. Yeah.
So with that streaming thing, you guys could do that at away games too?
Yeah, I think most schools are getting it. Yeah. I can't guarantee that every school has it, but some got it last year and there was a cost to it. This year with this crisis, they offered, there's still a cost. We got the devices, the cameras and the setup for free. And then there's a small $1,500 setup and training cost that'll come with it. So they tell you it's for free, and then you call them and they say, well,
That's something you use that federal money because it's technology.
I don't know. It's a good question. We certainly have a good
You're
healthy
training so you can broadcast the stuff.
That's right. Graduation or other assemblies. We could
take it away.
Yeah, that's right.
What's on the table with IHSAA in the next meeting? Are they considering seasons or anything like that at this point?
So I've tried to advocate a little bit for changing the seasons around. I think it's a very smart idea to put this fall sports that I consider to be very, very, that work very well with physical distancing. I think you could do baseball and softball with masks. Those kids didn't get to play last year. You could do baseball and softball with masks only like when you're on the bases. You're standing right by the first baseman. The outfielders wouldn't need to. The pitcher wouldn't need to necessarily. I think you could do track through staggered starts. Other schools do like golf and baseball or golf and tennis in the spring. Those are physically distanced. And cross country is normally fall. But my thought is the spring sports kids kind of got screwed over. Why not give them a chance to play this fall and do their sport? And then because all of those sports fit with, this idea of physical distancing, then see what happens in the winter and plan for like a spring football. I've mentioned it. I don't think there's necessarily any plan to do that at this point. It gets
what Washington did.
Yeah. Washington is, I can't believe, so it's not simple is what happened in Washington. It's very confusing. I was reading in the Tribune, like football can practice for 20 days this fall, but then they have a mandated stop because now they have like 4 different seasons or 5 different seasons. And then they have to stop, and then they start again February 21st, I think it is, or February 17th is their opening day of football practice for spring football. And I'm like, I can't imagine practicing for a football on February 21st. But
Well, I think because they're like
indoors.
Boise, well, they start their spring football practice for their fall season in the spring.
Yeah.
I got nephews down there. They've been in practice last month.
Right. Yeah.
They
Now-
now have like 10 days off,
Yep.
and then they'll start, I guess they call them conditioning practice.
Right. And again, the kids show some lower risk of spread, although it's a little bit conflicting data about these older kids and the level of spread that they can exhibit. We're kind of going into this in all these things a bit of an experiment because the science is not as solid as we would all like it to be. But So I don't know. And a lot will be out of our control, and a lot even regionally. Like you've got a school that has to shut down their high school. And then how do we make that fair? Do they get to reschedule their games, or do they automatically forfeit their games? And, how do you do a district tournament? Or, one thing that I am advising our AD is to not do these jamborees and tournaments where a whole bunch of schools are mixing. Those need to be canceled. And I think it's happening statewide. Individual games with individual schools. But it's tough. You play one team on Monday and then another team on Tuesday and Thursday and Friday, and then another team the next Monday, and then you get a call because it's 7 days for a test that says, hey, remember back last Monday when you played Kendrick? That kid tested positive. You need to test all your kids. And you also need to call everybody else who you've played this week. I mean, it is logistically very, very tough. But, Jackie and I have had conversations. So what if? We got a plan. So, there's thoughts from maybe you just advocate for just leagues. So we just play Kendrick, Timberline, Summit, and Deary. Those are the teams that are there.
Looking at, but then you're crossing 4 counties.
Yeah, yep. And so then the other idea was well, maybe we don't care about school size, but we just say, hey, Grangeville, Cottonwood, Highland, Kamiah-Kuski, Summit. Let's just play a league. Who cares? I mean, Grangeville's bigger. Yes, it's not really fair, but at least we get to have a league, buy a big trophy, have a championship because we're all kind of close together. That helps to reduce the risk. Maybe in the most extreme scenario, I would advocate for, look, we still pay our coaches to work with kids, and we move to something that's more intramural. So maybe our high school kids get to mix and play. And I know they're probably rolling their eyes if they're listening, but maybe it's pickleball for a couple of weeks and we have a big tournament. And then the next couple of weeks is dodgeball or something where they can still be having fun, being active. They can still be coached and have that experience with a coach, but maybe it's not going to be exactly the same. But not just to give up and say, well, just go home, kids. Because, they just go hang out. They'll go party. They'll go, do whatever. And we need to provide them with something. Sorry. And then communication, I don't need to go through the details, but this is a plan just as far as how we communicate. And it gives a little bit of timeline onto when, as we move through stages. Because one thing parents need is a little bit of lead time. And we're not always going to have a great amount of lead time. But, one thing to kind of assure parents is we're not ever going to close the school down and bus kids home at 10 a.m. because we had a positive test in the school. That's going to be a decision that's made, and it's going to give parents time to react and do what they need to do as we shift. But just to be very clear, and from the very beginning, here are the stages. Here's the final plan. This is what will happen when we go to each stage. A lot of parents are busy and they're not necessarily going to read this whole document. So then as you go to stages, that you have the next stage planned and a message planned out. So, okay, and now, and tomorrow we're going to shift to category 2, and here are the things that you need to know as a parent. So that's just developing that plan. You can go if you need to too. I'm sorry. This is a long meeting. Yeah.
Actually, Mr. Teagues, you don't need to apologize. I didn't mean to hurry you along. I will say we've had superintendents in the past that will go unnamed when Mr. Fleming would have took 4 hours and a half to do this so far. So anyway, you're doing fine.
The last piece.
It's important.
Yeah, it is. Last piece is student social, emotional, and mental health. And it still needs to be built out a little bit as we talk about that and the importance of kind of managing that. And then several kind of appendix documents that are included, including some of those things, and then some CDC guidance and on and on and on. That's the crux of the plan. I realize that there's tons of questions and tons of little situations. And I was listening to the West Ada District in their meeting that they had last night, and a doctor talking to them about all the different possibilities. And I realized they are in a different place. They're a different size, but there's just so many different things to consider, and so many different things that, so you're doing all these really restrictive things that take away from kids in one area, and then you don't in another area, and all of a sudden it's like, well, what was the whole point then? If you don't protect them here, why don't you protect them there? The best we can do is the best we can do, and there sometimes are not great solutions no matter what. I do, it continues to worry me. I realize that there's politics to this, and that also it happened on an election year. It gets kind of ugly sometimes. I am trying my best to look at the best scientific data, consulting with our public health district, consulting with local doctors. I realize that now not even all the doctors are on the same page. I mean, which probably has never been the case. You can't get all farmers to agree or all doctors to agree, so everybody's looking at different things. Liability wise for the school district, the best thing that I can say, I know there's a special legislative committee talking about this, but from all of my conversations, if there was ever a liability, if someone ever wanted to sue the school district for some practice or coming down with COVID or something like that, one of the things that they're always going to look at is, did you follow the guidance of what the accepted medical, what the accepted, see, that's my automatic, shut up. What did the accepted medical and scientific community say to do? And if you can answer that question and say, we tried to do that in our, we made that best effort, then you're not, going to be found to be negligent. If you don't, if you buck that and decide to do something different, well, then it most certainly opens up the argument of, well, this school was negligent. The leading scientific and medical community experts were saying these are the actions that you need to take, and then you decided not to. And so that's always a part of the consideration. I do take it very seriously. Another report out of Germany today, research out of Germany, they had 100 people who tested positive for COVID. Approximately less, or around half of them, I think, weren't even symptomatic. 60% of those 100 people, so they all tested positive. Many weren't symptomatic. 60% of them in an MRI scan continue to have inflammation on their heart tissue. 60 out of the 100. So they didn't die. And if there's 60% that have inflammation on their heart tissue, and there's only 50 didn't even have symptoms. I mean, there's something there that even if you don't have symptoms, this virus, we're still trying to figure it out. I mean, we are in the dark on a lot of things, and we've blown past the number of people that die of the flu. 110 people died in Idaho in our worst year, and we will likely lose over 100 or close to 100 in the month of July in the state of Idaho. And so, we're passing car accidents and other things. And I've talked to people before about, car accidents, and a lot of this stuff happens behind the scenes, but our government has invested an enormous amount of financial and human resources to reduce deaths on the highway by an amazing amount. When you look at those graphs of how much they've come down, it's less visible maybe, but I think we're all trying to do the same thing in this environment and give the medical professionals some time. They've already made some great strides. The fatality rate does seem to be falling overall as we continue to learn from it, but give them some time to figure this thing out. And then again, it's not a new normal, but just a temporary normal.
I think here, one more, just a sec, I'll get you right in. I just want to follow up one comment about your liability discussion. Those exact same things apply to the political side of things too. And I think as a school board, we're pretty apolitical because we're focused on the kids. And those political things, as long as we follow the best practices, the known things like that, then we're going to be protecting kids and staff as well as we can.
Curious about band, choir,
Yeah.
even in the green zone, because they're
that was
projecting more and everything. Is that, I mean,
I think I need
and
to
especially not grade school required to take band?
there's no requirement to take band. And so, and our high schoolers generally aren't vocalizing. Yeah, but we've also, the piano and the rock guitar and the drums are less risky, but singing is. And I think we'll continue to have conversations with Joe about, what are the ways that, maybe we increase the actual spacing. Maybe it's like 6 foot 12. Yeah. And
Well, you put the
Health
singer
district
in
or
a sound
CDC
booth.
said anything about that?
I've seen stuff with the CDC, they do that case study of one of the most massive transmission events was that choir choir in Seattle,
Yeah.
where I don't have the exact numbers, but there was something like 70 people there singing.
Half of them.
One person had it, and 50 people got it from that single
And
event.
they were social distance, I thought.
No, I don't think they were. I think they were all just
That
standing
particular
and
one
singing.
was, but there was another choir that was social distance,
Well, and
and
still.
nearly half of them got it.
Oh, wow. Yeah. So, yeah, I don't know. Carol, do you have any thoughts about that if you're still awake?
Yes, I'm still awake. Thank you. I think music is a big discussion in all the schools, and trying to figure out if there's a way with the little ones. Sometimes they do a recorder, you know, their first year or so. They, you know, do some sort. If we could get them all tapping on, you know, drum instruments, that would be better. More of a concern with the brass instruments that actually spit into the mouthpiece and then spittle it on the floor, you know, and they blow it through. More concern about that. Social distancing as much as possible, but sometimes in the band it's just not. So there is lots of discussion. It also, in especially the bigger schools, some kids just live for music, and that's their draw to school. That's the reason that they keep coming. So trying to figure out ways to do it safely is what everyone's trying to do. Not say we're getting rid of it, just working with the music teachers to see what else we can do to keep it safe.
Yeah, and I think there's activities that Joe does, like percussion and some other things that we could
Oh, he's
reduce
great with that.
reduce the singing and just kind of come up with some other ways so kids are still learning rhythm and all of that stuff. But definitely a possibility.
Good shape now. 'Cause we have
Yeah, that's right. We don't have wind
We get guitar
instruments.
players, we don't have a tuba left in
Yeah,
the school.
That's right. So I don't know.
Do we have any more questions, comments from the board?
Yeah, and Carol's
either
here.
Carol
Carol,
or
is there
John.
anything else that you want to add?
The only thing I would tell all of you is that the school has put together a very thoughtful plan. I have reviewed dozens this fall, or some are already in opening for fall. And some of them are just pretty vague and nondescript, but covers, you know, the highlights. You know, Sean and his team have done a really good job of being very thorough and very thoughtful in all of those areas. So I know it was more detailed, but it's more detailed than a lot of the other schools that I've seen as well. Very, very thoughtful. I think if we can implement this and we can be on top of testing and catching the ones that are sick early, we should be able to keep that school open. You all, excuse me. But with that, I also would just say that the communication that I have with the superintendents, I meet with their group at least, you know, once a week about on calls. And then Sean, like he said, we've had other calls, and those will continue as we look at smaller groups. But I think it's important for you all to know too, if and when that first time comes that we have a case or 2 or 3 or whichever, sometimes the school will know before public health does because of the parent reporting or a family reporting. If that's the case, Sean will let us know and we'll be helping. If public health finds out first, I will be making a call to Sean. We've had the discussions how important it is on public health side for HIPAA, that medical confidentiality, and on the school side for your FERPA requirements for confidentiality and security of records for children. We will not be violating any of that, but there is a need to share some of this information between public health and the schools so that we are on the same page and helping you all as school boards make decisions. So that communication, I feel very fortunate that we have that open communication already, and that when fall comes, that will just help us as we're trying to deal with issues. And then just one final comment, Sean, just making sure that the school board, you all know as trustees in the school, the decisions for opening, for closing, for moving between these stages is truly your decision, not mine. I am here as a consultant, as a expert, hopefully in public health for you all and for your administration at the school. And we can make those decisions together if I can give you input, but that is not my decision to make. So just making sure you know that I won't be running herd or hotshot on any of you. We will do this together, and as you need me, I am here for you and for your administration, but not a heavy hand, absolutely.
Thank you. For
Thank you,
coming
Carol.
tonight. Appreciate it a lot. Okay, any other board or comments from anybody?
Sandy, did you have anything?
She's muted.
No, I don't have anything.
Thank you, Sandy. Okay, then, I guess we entertain a motion to adjourn.
I move to adjourn.
Thank you. Do it.
Second.
Okay, anybody opposed? Anybody abstain? Then you're unanimous. Thank you, everyone.
Thank you for allowing me to attend.
Thank you.
Thank you.
Thanks, Jackie.
Yes, thank you, Jackie. And everyone else who visited, we see you all there now.
No, I didn't see that. I forgot to turn off. 3 to 9. Oh.